Good morning, everyone. I hope this week has been treating you well. I'm Laura Nwogu, a reporter for the Atlanta Voice, giving you 60 more years of being a voice to the voiceless. This morning, we are here with Dr. William Alexander, a nationally recognized healthcare quality leader with a lengthy career as an administrator and in academia. He is currently president of Alexander Healthcare Consulting, where he provides consulting services on healthcare quality improvement, health equity, population health, and clinical quality strategy to health plans. A board-certified internal medicine and infectious disease physician, Dr. Alexander has served as a member of the Infant Mortality Task Force of the Georgia Department of Public Health and the Georgia Maternal Mortality Review Committee. He also serves on the advisory board of the Institute of Health Administration at Georgia State University. And this is just a short introduction to his many contributions to healthcare in Georgia. Thank you for joining us, Dr. Alexander.
Thank you for the invitation.
Of course. This week, we're observing Black Maternal Health Week, which not only celebrates the work of local organizations and leaders in their fight for transformative and sustainable improvements in Black maternal health, but aims to bring awareness to the systemic oppressions, reproductive injustices, and health inequities that have disproportionately affected Black mothers. The theme for 2025 is Healing Legacies, Strengthening Black Maternal Health Through Collective Action and Advocacy. To begin, Georgia has the highest mortality ratio in the U.S. On top of that, Black women in Georgia are nearly 3 to 4 times more likely to die from pregnancy-related complications than white women. Can we dig into some of those pressing factors that are contributing to this gap in healthcare when it comes to Black women?
Sure. There's historical context, and then there are issues around, do I know what my health issues are, and are they being treated effectively? Institutional and structural racism and discrimination has had an impact on African American health for a long time, and in this area in particular. And when one moves from those two very strong factors, things that influence care and outcomes for African American pregnant women are, do they have insurance or not? We know in the United States, if you have insurance, you're generally healthier and actually more productive. After that, what access do you have to providers so that you can get the care that you need? And I think more recently we become more sensitive to the impact of social determinants of health. And things like where you live, is it a safe community? Do you have access to healthy food? Do you have transportation to get to the doctor if necessary? All these things have an impact on health and health outcomes. So those are some of the things that contribute to, unfortunately, the disparities that we see that you mentioned, in terms of an increase in maternal mortality and the implications of not getting the kind of prenatal care that you need, the impact on the fetus, and whether there's a challenge with a low birth weight baby or a premature baby that could contribute to that child spending time in the neonatal intensive care unit. And so those are some of the factors. I think what we know here in Georgia, and looking at African American pregnant moms that make up around half of all the deliveries in our state, we're about 30% of the population, but half of the deliveries in Medicaid, is that many of them have chronic conditions that may not have been diagnosed and treated. About 25% will have high blood pressure. So we're talking about women in childbearing age, defined as 18 to 46. 25% may have hypertension that has not been treated. Another 10% will develop diabetes during pregnancy. 20% have a behavioral health challenge that includes substance use disorder or addiction. And so you have these other factors in the background that, if they're not treated, that can cause some challenges for the mom and for the baby. I think we're more sensitive to the fact that pregnant moms can get into trouble after they deliver, and that during that 12-month period after delivery, they may develop unexplained increase in high blood pressure or other complications that can be serious, including death. And so it's a complicated situation where you have this backdrop or background of chronic conditions, and then dealing with the social determinants of health, and then dealing with the overall impact of institutional structural racism and discrimination. Many African Americans and many African American pregnant women have had bad experiences in the healthcare system. They've not been treated in a respectful way. And then that has an impact on trust. And so that's even another factor. If you don't trust your providers, if you don't feel that you have providers that are culturally competent, that will treat you in a respectful way and not necessarily and not poo-poo symptoms that you might have, all that can have an impact. And so it's complicated, but there are various aspects that we all can work on, to try to improve things.
You made some very important points that I'm going to touch on. One was that when people think about Black maternal mortality rate, they may be thinking of before the child is pregnant, but it's also postpartum. And so Black maternal mortality rate looks at before the child turns 1, correct? 1 year?
Well, actually, with the year following delivery.
Okay, the year following delivery. Okay.
Right, and some of that mortality can be related to the pregnancy itself or other conditions that might have an impact, like domestic violence. So if you had high blood pressure or have some heart disease related to before pregnancy or related to the pregnancy, that could have an impact in the following 12 months. Or if it's violence, that could be another reason that's not necessarily related to the pregnancy itself.
Yeah. And you also mentioned that Black women are often treated differently when it comes to healthcare. It's implicit bias in the healthcare space. Are there maternal warning signs that healthcare providers or families or even the mothers themselves can watch out for?
Well, I think if you don't feel right, don't ignore it. You need to have, and hopefully you'll have an advocate, a family member, a close friend, who you can confide in, can be your advocate when you go to see the doctor or you're getting care. Talk to family or advocates, but don't ignore however you're feeling. And then talk to your provider to make sure that you get the care that you need.
Yeah.
But I think that's the main thing. We tend to ignore symptoms that develop, whether you're developing some chest pain or shortness of breath, or you've had swelling in your legs that's new, or there are a lot of things that rather than ignoring them, try to be proactive and get them evaluated as soon as possible.
Yeah. And when Black women get into these rooms with their healthcare providers, what are some ways that the healthcare providers themselves can eliminate implicit bias? What are some ways they could bridge that gap and increase the trust?
Well, for many providers working with insurers, they can actually engage in cultural competency training. And so that's encouraged throughout the system. I think the main thing is having in your own mind certain questions that you need to ask so that however the conversation goes, you're making sure that you're following up on those questions. And they're straightforward. What are the issues? Why are they important? And what should we do?
Yeah.
And so if we get a little off track, those are the questions. You get a little off track, well, here are the issues I've written down or memorized that I want to discuss and get answers to.
Yeah.
And so I think we all have to be advocates for our own health, but I think if you have some questions in mind and you've written down what you're concerned about, that we are persistent in trying to get answers to that so that we can move ahead.
Yeah. And more into, you are a part of these important task forces that are looking at Black maternal mortality rate. Can you talk about what pushed you to join these task forces, and also what are some solutions and policies that are actively being worked on?
Right. Well, for many years before moving to consulting, I was a chief medical officer for AmeriGroup Community Care of Georgia, one of Georgia's Medicaid insurers. And we've been providing those services to Georgians for almost 20 years. So in my role as chief medical officer, where you're working with professional organizations, you're working with the state, I was honored to serve on these boards as the managed care insurer representative. And so anyway, that's how I ended up on those boards. And for the maternal mortality, I was able to serve on the board for 6 years as a particular. So that's how I got involved there.
And for the people out there, what are some policies or what are some solutions that are actively being worked on to reduce the mortality rate?
Well, I think what we learned on the task force is that we looked at mortality either related to pregnancy or associated with pregnancy. And certain patterns became apparent. I think for many women in our state, cardiovascular disease, I talked about high blood pressure before, was one of the leading causes of maternal mortality. And so that speaks to what we were talking about earlier. We've got to figure that out sooner, and then it needs to be appropriately treated so you minimize the impact. Then we also learned the unfortunate impact of substance use, violence, having an impact on women in Georgia, pregnant women in Georgia. So in monitoring that and bringing more awareness to it, it had an impact on what we're doing in the state in terms of coverage for pregnant women after they deliver. For many years, it was just 60 days. But we learned that these complications can happen all the way out to 12 months. So in the state did the right thing. We moved it to 6 months, and now it's to 12 months so that women are in a system of care so that they can be monitored. If they have some of those chronic conditions, that you want to make sure that they are treated effectively to minimize some of these adverse outcomes.
Okay. And we're in Georgia, obviously, and the landscape of reproductive rights has significantly changed in the past few years. Can you kind of talk a little bit about how those changes, like abortion bans, can impact Black maternal mortality rate?
A couple of years ago, we were trying to encourage the following, and that is that women develop a reproductive life plan so that if we could have a plan, about half of pregnancies are unplanned, and then you can spend time trying to figure out what are your health challenges and how do I optimize my health, then we could have a positive impact when a woman becomes pregnant. And so to me, focusing on improving your health and being as healthy as you can be, and then if you plan to become pregnant or become pregnant, you're in a better position to have a healthier outcome.
And are there, like we said, the theme is healing legacies. In the midst of this fight for improvements, how can mothers and their families and the community find unity while taking collective action for these improvements?
Sure, I think be aware, and this follows what we just talked about. Pick an advocate in your family, close friend that will be your healthcare partner and advocate for you in those times. Because when you see the doctor, you may not be thinking about those questions I mentioned earlier or what's on my list, and you have someone who you trust that will raise those issues. I think the other thing is just how do I leverage resources in whatever community I'm in to try to improve outcomes. we all need advocates. So you have a personal advocate as a family friend, your choice. But there are folks in the community that have expertise to help you navigate your pregnancy, like doulas. Plenty of data to show how doulas have helped improve outcomes because they become your advocate and they help you navigate the system. Do you have a culturally competent provider? Are you getting your prenatal visits? Did you start your prenatal visits during the first trimester, not the third trimester? Unfortunately, a third of pregnancies, the first time they interact with the systems in the third trimester. Well, if you start your care in the third trimester compared to the first trimester, all your risks go up in terms of adverse outcomes. And so, what are your resources for advocacy within your community, not only in the cities of the state, but in rural areas? Where am I going to deliver, depending on where I live in the state? If you are a woman that has those chronic conditions and quote unquote is high risk, do you have a case manager, an obstetrics case manager that's a part of your insurer that's going to help you in terms of maximizing your benefits to make sure you're getting the care that you need to improve outcomes? And so where am I going to deliver if I have a high-risk pregnancy? There's certain hospitals that are better suited to deliver you and take care of your child if you're a high-risk mom than others. And we know that's in the backdrop of what's going on in the state, particularly in rural parts where many rural hospitals have closed. And so you really have to be proactive and know, where am I going to go? There's certain hospitals in the state that are built to take care of high-risk women. And so you need to know, if you're a high-risk woman, where those facilities are. And then what is your transportation plan, if necessary, to get there? We know if you have transportation issues, then that increases risk. And that should be, it's pretty straightforward because it's going to take you longer to get to where you need to get the care that you need if something is happening. So all those things, I think, go into how you navigate. And then finally, there are organizations, as you mentioned, who are focused on advocacy. And so how do you then connect with those organizations so that I better understand my condition and have this as another support system, if you will, to make sure that I have the best outcomes possible?
Those are some very important points. I know during that time, many mothers out there, it's a hectic time, but it's also a happy time. So just having those tips in mind, I know will be very helpful for a lot of people. For any, you've kind of answered this throughout, but for any expecting mothers out there, any people who are planning families, who are maybe concerned about these disparities, do you have any more advice to give to them in this time?
Well, we've talked about quite a few things, right? But sure, just be your best advocate. I mean, I think one of the things that we have to manage as a people culturally is this notion that we can deny when we're having symptoms. We can, not deal with them. And that's a big challenge. Rather than saying, I'm just going to accept what these symptoms might be related to, go get them checked out. And so I would just encourage people, you have the right to be as proactive as you can about your health. But you're going to have to do some homework. And I think another thing that's important is that during these changing times where insurance care coverage, the state has made some decisions to make some changes in terms of health insurers that it's going to be quite disruptive. 1.2 million out of 1.6 million Georgians, based on decisions made by the state recently, will have to change Medicaid insurers. The impact of disruption can be significant. So you can imagine if you're pregnant
Yeah.
and you're in your second or third trimester, you do not want to change your provider because insurance coverage changes have occurred. So disruption, we've got to think about the impact of that on access to care and how that could potentially delay if I've got to change doctors, change hospitals, new system in terms of how healthcare benefits are provided. All those create delays. And so we're very concerned about that because we're fighting that uphill battle against healthcare disparities and trying to create more health equity. Disruption leads to delays, and that very concerned about the impact of that. And so one thing from an advocacy perspective is to talk, question the state about that decision. Providing more choice is fine, but to cause that much disruption, 1.2 million, and then tens of thousands, maybe 30,000 pregnant moms on Medicaid in Georgia is concerning.
Yeah. And speaking of advocacy, this is my final question for you. Are there any organizations, local organizations out there or leaders that people should watch out for when it comes to Black maternal health?
I think I would just, there are some that have been around for decades that have been advocating for women, and then there are some newer organizations. And so I'd encourage you to do your homework, find what advocacy group potentially could work for you, and then if that's your pleasure to work with them or learn more about them to improve my health and health outcome, I'd encourage you to do it.
Thank you. This was very informative. I don't know if there was anything else you wanted to add or anything I didn't touch on that you want listeners to know.
I guess the final thing is that I would just share is that we know we have challenges related to social determinants. And whether it's about better nutrition and addressing food deserts, transportation is a big challenge, particularly if we live in rural parts of the state, just to name a couple. But there are some innovative things, quote unquote, that are happening to try to address these barriers. And so one, for example, would be how do you leverage telemedicine in areas of the state where there may not be the hospital, it takes a while to get to the providers. Telemedicine has been used to try to bridge that gap in our state, and so that raises questions about, well, what are the telemedicine options for me depending on where I live if I need to get care? So that's something to keep in mind. There are programs that do remote patient, what's called remote patient monitoring. So let's say you're a pregnant mom and you have high blood pressure. It's going to be important for you to measure your blood pressure and that be monitored. And insurance companies have partnered with organizations to do that, so that if your pressure is elevated or your blood sugar is high, then we're not waiting around to address that. We're going to address that as soon as we can, depending on where you are and where you can access that care to address the issue. And then finally, there are some virtual solutions where there are organizations that have a virtual team of doctors and nurses and other providers that literally will take care of you virtually. Again, addressing some of these social determinants of health that are providing creative solutions to meeting the healthcare needs of pregnant moms. And so there's the advocacy piece for yourself, being proactive and treating chronic conditions if they're diagnosed proactively, and then in answering the question, where am I going to get providers, or how can I get the follow-up that I need? These are some of these creative solutions that have come to the fore over the past couple of years that I think we need to be, the folks need to be aware of. So
Perfect.
I think we'll end on that.
Thank you so much again, Dr. Alexander. I learned so much. I hope everyone took away some very great tidbits from this in ways that we can better serve our mothers out there.